And welcome back. Well, we have Dr. Neil Goldstein with us today from Pettis, Orange County. I'd like to welcome you.
Thanks very much.
And first, tell me very briefly about yourself and Pettis, Orange County. And you're here to talk about vein diseases, correct?
Yes, I'm an interventional radiologist, a vascular specialist.
Okay.
And Pettis, Orange County is an outpatient vascular center where we do a broad range of arterial and venous procedures, all without a patient needing to be in a hospital.
Oh, okay. Very good. What is CVI, and how do you know if you have it? What does that stand for?
So CVI stands for chronic venous insufficiency.
Okay.
So venous insufficiency is a broad term, but it basically implies that the veins are not functioning properly. Mm-hmm. The veins contain valves in them that keep the blood flowing in one direction from your legs back up to the heart. And when the valves don't function properly, blood can pool with gravity down to the lower part of your leg under pressure, and it causes a broad range of symptoms. Mm-hmm. So some of the symptoms can be cosmetic. This is one of the more severe cases that we see here. Mm-hmm. So the cosmetic symptoms may be the dark blue spider veins you might see at the surface of your skin, or the larger, very tortuous varicose veins. Mm-hmm. And while those can be cosmetic, they can also be very symptomatic. They can be painful, they can develop blood clots and inflammation, and they can bleed, so they can be very serious as well. There are more serious symptoms such as pain, weakness, fatigue that can be very disabling. Patients tend to not be able to tolerate being on their feet all day and to conduct normal activity. And while it's kind of a slow, steady onset that gets worse over time, a lot of us attribute the symptoms to just normal aging, but it's really a problem that can be addressed. Beyond that, we can see signs of swelling, and we can see skin changes that are as a result of the high venous pressures. The skin thickens and gets hardened and discolored, and even can tend to break down over pressure points because it's not healthy skin. It can't maintain its integrity.
Right.
These are very disabling, very serious problems that are difficult to manage if they're not caught early.
Who should be screened for CVI? How would you know this is, I need to take another step here?
Yeah. Well, if you
go to a specialist.
If you have any of the symptoms that I just described, so if you see that you have large, abnormal-looking veins, if you have symptoms of pain or fatigue in your legs that is limiting your activity. Interestingly, it tends to affect women more than men, maybe twice as often, and it tends to be a lot more common as you get older. So the highest incidence, I think, would be in women in their 60s and 70s that they maybe have about a 70% chance of having the condition.
Okay.
And if you have a family member that has the condition, you've got about a 40% chance of having it yourself. It does tend to run in families.
Oh, okay.
Yeah.
Interesting.
The actual inheritance pattern has not been completely worked out, but there's some interesting studies comparing twins. So if one twin has it, there's a 75% chance the other twin may have it.
Yeah.
So there's definitely a family connection.
And how do you treat it? What's available?
So treatment's very simple. In the past, there used to be major surgeries that were done, which were difficult for patients.
Yeah.
But over the last 10 years, we have developed a lot of catheter-based methods for dealing with these problems that are done in an office within an hour under local anesthesia. They're very simple. Just by accessing the vein with a needle and inserting a catheter through the needle hole, we can cauterize the vein on the inside so that there's no more abnormal flow, and it depressurizes the whole abnormal part of your venous system.
All right, and I wanted to mention, we just got about a minute left, that you are offering a complimentary vein disease screening through this month and then June, correct?
That's correct, yeah. If you look on our website, which is pettisorangecounty.com, it's P-E-D-E-S, Orange County is one word.
Okay.
And, or you can call our office number, the number's on the website. We can schedule a free screening appointment where we can examine your legs and take your history and see if you'd benefit from further treatment.
All right, what's your office number? You don't have it at the top of your head. That's
on the
okay.
website.
Go to the website. Oh, wait, look, I have it there because I got it off the website. How about that? I was ahead of myself. 387-4724 and 949-387-4724. There it is for you. All right. Doctor, thank you very much. It's great information. Thanks for coming on today.
Thanks for
We'll
having
be back. We'll hear from the Dog Club in just a moment.